Hi, welcome to the Coffee Chat Show here on Buzzing Pattaya, the show we talk about things that are happening right here, right now, as well as general news, tips, information and advice. And today I'm delighted to welcome Dr. Cham to the studio. How are you doing, my friend?
Yeah, I'm okay.
Great to have you on board. Now, guys, this is a really important video, one that I want you to really take on board, because what we're going to talk about is some really important stuff, isn't it? It's some really good stuff, and it's going to help you and benefit you. I've got a list here, it's long. We've got testosterone replacement therapy, sexual transmitted disease, helping with that weight management, chelation and liver detoxification. Is that if you drink too much?
Yes.
Yeah, okay.
In case.
Guys, you need to be listening here. Now, before we get into this, Dr. Cham, how long have you been here in Pattaya?
I'm stay Pattaya for 2.5 years.
2.5 years?
Yes.
And before that, were you studying?
Yeah, I'm studying about the anti-aging and regenerative medicine hormone replacement from American Academy.
Oh, okay, an American Academy,
Yes.
wow.
So now I get American board already last year.
Yeah.
Before I open my new clinic here.
Yeah, brilliant. Well, if you're not sure where we are, guys, we're here at the Wellthyme Wellness Center. Now, if you look on the map right now, you'll see exactly where we are. It's a very, very easy place to find. If you know where the turning is to go into Soy Bacau off South Pattaya Road, we are literally just before that if you come down from 3rd Road. Now, before we get into everything, what time do you open here?
We open from Monday to Saturday, 9 a.m. to 6 p.m.
9 a.m. to, so
Yes.
Monday to Saturday, 9 a.m. to 6 p.m.
Yes.
Okay, and the thing I like about what you have here is people can just walk in, correct?
Yes, yeah, you can walk in, even you can make appointment also.
Okay,
like
so
that.
there's no need to worry if you suddenly something happening, oh, I need to go and see someone, they can just come in and see you.
No need, yeah. And for the special thing of our clinic, it may be different from other clinic is, the first person that who will talking with you is me. It's a doctor that will be like say hi with you for the first person. So the enough information, good information and the quality of information is here.
Right, understand.
Like yes.
So I want to throw this back out to the guys that are watching this. What's the most common procedure that you carry out here? So when guys come in through the door, what's the number one treatment that you give to people?
Okay. From my observe here is about like 80% is testosterone replacement therapy.
Okay, and when you say testosterone replacement therapy,
Yes.
just to help everyone watching this, so if you're feeling a bit low and no self-esteem and maybe you've lost a little bit of your libido for the evening's entertainment, this is something you can help with.
Yes. This one is like the normal situation in the middleman. Right? Because when we middleman, I mean it's like the age more than 50-year-old, more than 55-year-old. Someone will feeling, he feel not the same as before. Like 10 year, 20 year ago, he not self-esteem as before, like that. So the symptom that the patient will come to me, actually we not say patient, the normal healthy people, like that, low energy, low sex drive, mood swing, low libido, like that, and then come to talk with me, something happen or not, and then we will make the new big blood test we call comprehensive blood test, and then we will take time to talking about the comprehensive blood test and the symptom about 40 minutes to 1 hour before start program.
Okay. And can I ask, I mean, there's a lot of guys that you're describing there that are sort of 50, 55, myself included. I mean, what is the common reason why we suffer with these low libido, low sex drive? Why does that happen to people at like certainly my age? So I'm 56.
Okay. Yeah. Because when we get aging, right, we have to understand about aging. Aging is the normal situation for everyone. When we get aging, that hormone that we have when we are 25 to 35 year old, on that time everything perfect, right? Fight to fly, I want to drive car to another province, like that. Have many girlfriends, sorry, like that. This one is the normal situation, right?
I understand.
But when we get aging, like more than 50, 55 years, everything is try to drop. Daytime sleepy, after dinner also sleepy all day, low energy, low sex. This one is mean low testosterone symptom.
Okay.
And hormonal imbalance, like that,
And does a large intake of alcohol also affect you? Is that something they've got to balance with as well?
Yes, it can be happen also.
Right. So you've got someone watching the channel now and they can relate to everything you're saying. So, we're over 50 and, we don't have that same energy as when we were 25.
Yes.
what's the course of options that they have available? Is it like a tablet medicine? Is it an injection? How does it work?
Okay. Normally, as our clinic, we use bioidentical hormone replacement therapy. We have to differentiate between bioidentical and synthetic hormone.
Okay.
Synthetic hormone, this one we don't use it. Yeah, we use bioidentical. What that is mean of bioidentical hormone replacement therapy? It means the hormone that have same structure with your body production. This one that we use.
So biological means it's what you would naturally produce.
Yes, correct, correct. And which way is like more stable? Injection is more stable.
Okay.
Why like that? Injection, we control the drug.
Right, I understand.
The first form that we have. Second form, the gel form. We have also. The gel form, the drug control you. Why like that? Because the Thailand is hot like that, you know. If you apply the gel,
Right.
Are you sure it's 100% will absorb to your body?
Okay.
Like that, you know.
Well, I suppose if you're hot, you'd sweat it out
Yes.
rather than absorb
Yes.
it.
And the next thing important is like, if you have girlfriend, if you have your baby, that who don't want testosterone like that, how can we avoid this problem? Like that, you know. So the gel form, maybe we have to discuss some point. The last form is the tablet, right? The tablet for testosterone, I'm not recommend.
Okay, and
Why
why
like
is that?
that?
Why is that?
We have like the first part metabolism in stomach, right?
Yeah.
That will degrade your drug about 30%.
Okay, so
And
when
then-
you ingest it, 30%.
Yeah,
Okay.
and then we have some liver detoxification process. And the testosterone drug tablet form is will damage liver.
Oh, okay. So you take the tablet form, basically your body will take away 30% of its effectiveness, and then it will go through your liver, and then
Yeah.
it will obviously damage the liver as
Yeah.
well.
Yeah.
Right. I mean, one of the questions I'd like to ask you, please, is I was told a long time ago about testosterone that if you start the testosterone program,
Yep.
that your body will never recover. It will always rely on that testosterone help. Is that true?
Okay. If we start testosterone, it means like we have to see first which one that we want to use.
Okay.
We will use testosterone drug, or we want to use something that will stimulate natural production. It means HCG, or human chorionic gonadotropin. This one will stimulate your natural testosterone. If you concern that like, I plan to have baby, or I want to preserve my testicular site, okay, I recommend HCG.
Okay.
But if you ask like, stay with testosterone for the whole life, it can be or not. It can if you still get benefit from testosterone. And how long I have to take testosterone? As long as you still get benefit. And after I stop for how long, my natural production will come back. About 2 to 3 weeks, will come back to your natural level, like that.
Right. So if your natural level is already low,
Yeah.
then pretty much you're going to have to rely on testosterone
Yes.
for a longer period of time.
Yes.
Okay. And is there any damaging effects to taking testosterone on a weekly or how is it weekly or monthly you do this?
Okay. Our clinic, we provide testosterone replacement therapy monthly program.
Monthly. Okay.
Yeah, that if you ask about the side effect or something damage to the body, I told at the first sentence, right? We do the big blood test.
Yes.
We call comprehensive blood test that have general part and metabolic hormone panel part. That will include everything, include the side effect of testosterone. It's
Right.
like the red blood cell, PSA level, prolactin hormone, everything I will see first. You safe or not? If you safe, okay, we go ahead. And then every month, we check your blood every month to monitor. That's why at here is the licensed clinic, and I am Thai medical licensed doctor. That will monitor your side effect and will like take care you every month. We call use hormone replacement therapy under doctor supervision. Can we say this sentence, right?
Okay.
Yeah.
Yep. Okay, I understand that. So the long-term effects are constantly monitored.
Yes, yeah, we have to monitor. If something happen, we have to discuss first, like that, you know. In case like high red blood cell production in the body, okay, maybe we have to do the blood donation. It means the bloodletting, right? Bloodletting every 3 months related with red blood cell production. It's normal situation that we can meet.
Okay.
Yeah.
So in terms of testosterone then, we're talking a once a month treatment plan based on the results from the blood test.
Yes.
You constantly monitor it to make sure that if there are any additional effects that are happening inside your body, you see that straight away and you change the direction and monitor it that way.
Yes. Yeah.
All right. And in terms of prices, what sort of price are we looking at? I mean, this is at the time of making this video, guys, so things may change. So please don't come and say, oh, well, you said this. It might change. But right now, what is the cost of testosterone?
Okay. Testosterone replacement therapy, we starting from 8,999 Thai baht per month.
Okay.
Include what I will explain to you one by one. Testosterone injection twice a week, vitamin B12 injection once a month, vitamin D3, zinc, magnesium twice a week, and blood test every month, doctor consultation, nurse service. So everything is included in this price already. We call one-stop service here.
So can I just interrupt you? I want to ask you, because you've just said something that's really important to me. So 8,999 baht right now.
Yep.
And you get 2 testosterone injections per week.
Per week.
So that's 8 in the month.
Yes, about 8 to 9.
Okay, and you also get other additional support.
Yeah, other additional that I study already. This one will help about the body. It means the health status also. Why I give vitamin D3 example? Because vitamin D3 is help to absorb testosterone to your tissue and will increase immune system in the body also.
So I guess if you take that and you reduce the alcohol intent and you maybe exercise a bit more, you're going to be really happy with an evening.
Correct. Because testosterone replacement therapy or any other hormone replacement therapy, it will help you only about 60 to 70%.
Okay.
The other factor like sleep good, eat good, think positive, exercise, like that, decrease alcohol and smoking. Perfect. 100% sure that you will get benefit from testosterone.
You'll make my wife a happy woman.
Yes.
Okay.
Yeah.
So that's the testosterone side. Now, I noticed on here, one of the things, and I do get asked this quite a lot, because, we understand that there's a big nightlife entertainment scene here, and, we understand that. And it's always kind of like the morning after you think, oh no, maybe the condom broke, or maybe you didn't take any protection.
Okay.
Maybe you're in a situation where you think, oh, this is not good. You got down here, sexual transmitted disease. And I appreciate the question I'm going to ask you now is a difficult question, but is there really a lot of this in the city, or is it pretty much okay?
Yeah. Okay. We can talk like here is the Pattaya city, right? It's the wonderful city. Yeah. So the condom broke is the normal situation that I meet like that, We have two different drugs first. We have PrEP and PrEP, right? PrEP and PEP is different.
Okay, PrEP and PEP. Okay.
Yeah, PrEP and PEP is mean pre and post, right?
Okay.
Condom broke is mean the situation happened already. We have to take PEP.
Okay.
It mean post exposure prophylaxis drug.
Okay.
This one we have to take for 1 month. We have here also. And we have to screening about sexual transmitted disease. Example, anti-HIV, gonorrhea, syphilis, candida, like that, we have to screening first. After we take the PrEP, like that. And before take also, like that, to make everyone like safe from this disease, like that. And what is the PrEP? PrEP it means pre-exposure prophylaxis. If you know you are multiple sexual partner, you can take this one for protect the HIV virus.
Okay, so this drug will basically, if you're not going to be maybe as careful as you should be, and you're going to have multiple partners, this will prevent you having any worries throughout that process.
Yes, correct.
Oh, okay. Yeah. So it's like an inbuilt condom, I guess.
Yes.
Because it's going to take care of you without you having to worry.
Yeah, because there's some situation we cannot control, right? Someone have like the heavy sexual performance like that, that I heard from my patient. Like that. Yeah.
Question I'd like to ask you, please, is one of the things that we are subjected to here all the time is you'll be sitting in the bar, you'll be having a beer, you'll be enjoying yourself, and a guy will walk past with his tray, with his Camagras and all his other gels and substances and all the other let's help you out products. What's your thoughts on those? I mean, are they worth the risk, or are you saying, look, guys, you need to be very careful? What do you think about these guys that walk around offering you these different gels and other substances?
Okay, I will. If he have time, I will take time to talk with him. That about the Camegra, Viagra, Cialis, this one. if you are our clinic have not, yeah, we have, but only the FDA Thai approved, like the Sidica from the GPO Thai company, Cialis from Lilly company, that the FDA approved we have, like that, But I will take time to talk with him. That one is the temporary things. The core thing or the main thing is testosterone hormone. It's the father of hormone that will help you for a long time.
Yeah,
like that.
I understand.
Yeah,
because these guys, they do walk around and they are trying to
Yeah.
sell you the gels and stuff. And I've always said to everybody watching, guys, not for me, because you get a lot of headaches and
Yes.
they may not be within
Yeah.
date and all the other kinds of things that
Yeah.
go on. Is there a real? What I'd like to ask is, if you was to say, I don't know, let's just say I'm sat there and I'm having a few beers, and the guy happens to walk past at the right moment, at the right time, and I think, oh, go on, I'll get some. Are they dangerous to me because they're not FDA approved? Are they dangerous?
Yes, it's dangerous, It's dangerous because we have to know the mechanism of this drug. It means they can make the vasodilation. It's not dilation only your genital gland. It will dilation everywhere in the body. When we get the vasodilation, we headache, right? We have flushing on the face like that. And someone is have hypotension. That one is very, very severe, like that, that I meet. And we have to be careful that by this kind of drug on the road, like that we can meet everywhere. This one I have to tell everyone the truth, like that, so have to meet doctor and consult about the dose also. It's not just depends on you what to want to take, that we saw the news, like that, some men get heart failure, get many things like that, but actually maybe it's overdose of Viagra and Cialis.
I understand. One of the other things on your list here, it says cell therapy and vitamin nutrition. Can you give me a bit more information about that? When you say vitamin nutrition and cell therapy, what does that involve?
Okay. The first topic I will talking about is vitamin nutrition, right? Nowadays, the world changed already. We never get enough vitamin from food, right? If we thinking about the sun, that will give you vitamin D3 enough at 20 years ago. It's not true. Because now the UV ray, the smoke, the PM 2.5, right? Yeah. How the sunshine come to the skin 100% same as before. That's why we have to take the vitamin and supplement like that. The food, if we thinking, salmon, a lot of omega-3 at before, it's not true. A lot of heavy metal is true, like that, So the new thing of the wellness, take wellness care, like that, Yeah. We have to take enough vitamin, mineral, and supplement, like that. And what that we give, vitamin nutrition, is the IV drip therapy. It's the high dose vitamin C, vitamin B12 is help for increased red blood cell. Vitamin C is work with the collagen. Vitamin B6 is help about the nerve system, right? Yeah. And then the cell therapy, this one is mainly something that will help about the new cell regenerate.
Right,
that
understood.
can be treated about the injury cell and inflammation cell.
So another one you've got in here, which I think will apply to a lot of people. We come out here, and I've done it myself. You come out here, you're enjoying the atmosphere, you're drinking probably far, far more than what you would drink if you were back home. Reality and the honest truth now is, what kind of damage does that really do to your liver? How much damage does it do by constantly drinking night after night after night, maybe for 2 or 3 weeks?
I saw many patients that heavy alcohol drinking, and then he went here for the blood test, and then liver enzyme is come up like that. Liver enzyme, we have AST and ALT, both of them come up, but it's just 100. We call my inflammation of liver. This one is the interpretation from doctor, right? So I asked him about the history. Okay, you are heavy alcohol drinking. And here we have liver detoxification program that we prove already. We give once a week, and then I make appointment with him again. His liver enzyme go down to normal level. What that we put inside, we put full-mucil and glutathione. This one is can help about the liver detox and will flush the bad enzyme go out of body.
I mean, again, just asking another question. I mean, I'm going to put my hands up. I'm guilty here. I never give my liver any thought whatsoever. When I'm drinking, I don't think, I might be doing damage to my liver. I mean, is it really as dangerous as it sounds? You know, if you keep drinking, will it really hurt your liver?
Okay, it will become fatty liver.
Fatty liver.
Yeah,
Okay.
because alcohol we ferment from the barley rice, right? Yeah. And then when we get fatty liver for a long time, and your liver will get like thicker, hard to
yeah.
And then the last stage of the alcohol drinking will be cirrhosis, right?
Oh,
or
right.
we can say like liver failure,
Yeah.
like that. You know, this one is very dangerous. So everyone have to be careful and concerned about this topic.
Really off topic now, but just a quick one. If I drink 2 beers and drink a bottle of water, 2 beers and a bottle of water, is that okay? No.
Normally it's hard to say, right?
Okay.
Yeah, it's hard to say because I'm doctor that like,
Yeah.
you recommend to drink
that's
beer
a
like
fair
that, you
point.
know.
Yeah, all right, okay.
But if you ask me which one is good, red wine. Why red wine, right?
Red wine.
Red wine we have like resveratrol that will increase the CoQ10 in your heart.
Okay.
But control amount, please.
Okay,
Like that, you
right,
know.
there you go.
Someone can make the research about the red wine and resveratrol and CoQ10 level in the heart.
All right, well, there you go.
Like that,
Dr. Champs told you now, guys. No messing about. Right, we're coming to the end. It's been really, I'll tell you what, I've really enjoyed talking to you. I've got one more question for you. And it applies to me, as you can see. It says here, weight management. Now, I'm absolutely rubbish at weight management. When I first came out here, when I was, what was I then, 42?
Yeah.
I was a 32-inch waist. I was a big, strong, muscular guy. Now I'm just a fat blob.
Yeah.
How can you help people with weight management? Because it's so hard here with the drink temptation, the food temptation, the let's just laze around, let's not exercise. How do you help with that?
Okay. The first thing for the why we gain weight, right? Because the first thing is the hormonal imbalance also. Because testosterone, estrogen, progesterone, this one is the producer or anabolic hormone that can increase muscle, decrease fat mass. It's opposite when we get aging, right? This hormone will be dropped, so we will gain weight, have more cholesterol, muscle loss like that, you know. So we will talking about your lifestyle is good or not, how you eat, did you control, you calculate calorie or not, exercise, how you exercise. So we're talking in the holistic, and then we have one thing that we call the magic pens or slender pen, or we can say like this one is the weight loss pen also, like that. What is this pen do? I proved by myself for 3 months and I lost about 14 kilograms in 3 months.
Really?
Yeah.
Were you drinking?
No.
Oh, well, that's cheating. We've got to drink as well.
Yeah, but I control my food by do intermediate fasting.
Oh,
No eat
right,
for
okay.
16 hours and let like 8 hours, another 8 hours to eat 2 meals per day.
Do you know, I talk about this on my live stream once about this intermittent fasting.
Yeah.
And I got bombarded with so many people saying it's great, you should do it, you should do it. And to be honest with you, I mean, like I sleep at sort of 9, 10 o'clock at night latest. And I don't I wake up early, but I don't actually eat breakfast till about 10 o'clock the next day. So I'm doing 12 hours.
Yeah.
But that's not really enough, is it? It needs to be more.
Yeah. That's why we have this pen to help you to extend the time for intermediate fasting. Because when we injection this pen, right, you will not hungry anymore.
Oh, really?
Because this pen is control about your hunger and satiety system at your brain. So you will success about intermediate fasting for 2 months or any time that you want, like that. It's not only control hunger and satiety system at your brain. It will be used the energy at your liver become the energy during your fasting.
Okay.
Right?
Okay.
Because I said before on the liver detoxification topic, right? We have fatty liver. Everyone have fatty liver. Because like when we eat, it will become glycogen storage in the liver. So this pen will be used this energy during we fasting.
Right.
And will be delay your gastric movement because when we have gurgling stomach, we will hungry, right? So we'll delay. So if we delay, we're not hungry anymore.
Gotcha.
That's why this pen make you success about lost weight, but need to be under doctor supervision again.
Okay,
Yeah.
brilliant. Well, we've covered a great deal of the topic here.
Yes.
I've really enjoyed talking to you. Thank you so much, Dee. If someone's watching now that wants to come in and get some advice, I mean, is there a consultation charge?
Yeah.
Do they have to? Is there a charge to come and see you, or is it a free consultation?
Yes, yeah. I give you guys about free consultation.
Okay.
Give you guys free consultation, and the first priority that you come here, you will meet doctor first. I'm Dr. Champ that will say hi, good morning, afternoon with you every Monday to Saturday from 9 a.m. to 6 p.m. I'm stay here if you come, but if a lot of patients can you waiting me for for a while,
Okay.
like that, you know. Our location is opposite Friendship Supermarket on South Pattaya Road.
Yep.
นะครับ
All right, brilliant. So free consultation.
Yeah, free
So
consultation.
there you go.
ครับ
Mention buzzing, guys. Come in, you get a free consultation,
Yeah.
and you'll be walking out a completely different person. Well, at least you'll know what you're doing wrong if you're not doing it. But I've really enjoyed that. Thank you so
Yes,
much.
thank
Been a
you so
pleasure.
much,
Been a
Kap.
pleasure talking to you. Thank you. Sorry, Buddy Cap.
สวัสดีครับ
Been brilliant. All right, there you go, guys. So what I'll do is, if you have a look down in the description of the video here, I will put all their links, their social media links, websites, telephone numbers. I'll put everything in there for you, so you can get a hold of Dr. Champ very easily. Come in, literally. We are just by the soy cacao market, like we just said then. Friendship. If you're not really sure about either of those, Tukkom. If you're walking down towards Tukkom's on your left. Look on your right hand side, you'll see the wellness here, and come and say hello to Dr. Champ. He's a really nice guy, very knowledgeable, and who knows, if there's something going wrong that you're not aware about, maybe now's the right time to come in and get it checked out. All right, that's it for me. Thank you very much indeed for watching. As always, guys, please remember, hit the subscribe button and also the bell icon if you'd like to be notified when we bring out a new video. Have a look on Discord. In Discord, we've got the rooms there. You've got a room in Discord, so you can
Yes.
connect with Dr. Champ there and ask him some questions in Discord. And that's it for me, and that's it from Dr. Champ. Thank you very much indeed. All right, that's it for me, guys. Thank you very much indeed for watching. And please, as always, wherever you are in the world, stay safe.